Hello, folks. So, in this video, I wanted to talk about mental health illnesses and whatnot, and any medical issues in general, right? And say ailments, diseases, and whatnot. So, recently I got typhoid, right? So that's this whole thing. It looks fancy, but nothing great. It's a very simple thing. And yeah, I mean, I got typhoid recently. I was diagnosed like some 5 days back, and uh, and I was checking out about typhoid and how do you get typhoid, right? It was disgusting though because apparently you get typhoid by food contamination or water contamination, which is one of my biggest fears actually. Uh, so I do, try to wash my hands often. Interestingly, I don't wash my hands before eating though. I do wash my hands almost every other time, say after I use the washroom, before I'm going to cut, say, vegetables or wash my hands and wash the vegetables, wash the fruits, wash the knife, wash the pad, wash my plate every time before I go to eat, wash my spoons and everything, right? But yeah, at office I don't wash the spoons. I mean, they wash it up already and they keep it, and I don't wash it again. Though ideally I should, based on my principles and whatnot. So, and I also wash the plates and spoons even after I'm done eating, of course, and I wash them again before eating. Though I've already washed it before because there are pests and whatnot in my rooms and whatnot, so insects and whatnot and cockroaches or whatever. I ensure that it's always washed before I use it. So, but yeah, recently I've started to wash my hands before eating as much as possible. I do that, especially use say liquid soap to wash my hands. I mean, I think liquid soap is the way to go because soap, I think it. I mean, even with liquid soap, you have to be careful about how you use it. Because you can contaminate a liquid soap also if you don't use it properly, if you don't refill it properly and whatnot. But soap, I think it's easy to contaminate it, so one has to be careful. Or so I think, right? Based on some very basic assumptions and whatnot. Probably it's not logical or scientific, right? So yeah, I mean, you get typhoid through contamination of food or water, or if someone infected touches me and then I keep my hand on my mouth or nose or something like that, right? So basically, it's an infection and it's a bacterial infection, and they diagnosed it through blood test. It's called Vidal, WIDAL, and there are different kinds of bacteria strains. So I think the bacteria is called Salmonella, and there are different strains, varieties, and I had one of them, I think. Today I tested again, and as part of my blood test it says negative. But I've also read that typhoid, once a person is affected by typhoid, even though their symptoms are gone, they can be a carrier for 12 months or more. Apparently, one has to do a stool test to understand. Stool test is basically poop test, and I think even urine test. Both of these. Surely, stool is one of them. I think urine they didn't mention, but I'm guessing that also has to be tested and understood if they are still a carrier. Because so the idea is this, right? How does one get contaminated? Like say, how does the food or water get contaminated that leads to typhoid? Basically through feces, through poop and urine, something like that. I'm not sure how it exactly happens, but that is one way. Another way is say through wounds. Say someone who is infected has a wound, and somehow the blood say gets mixed up with say food or water somehow, right? This is something that I've heard before also, not just with say typhoid. Let's say I've heard this. I don't know how true it is. Something to check out and research. Someone with HIV was serving food, and they had a wound or something, but that is not exactly possible. Like you drinking someone's blood will not, someone's blood who has HIV will not give you HIV. I think your blood has to mix up with their blood. You drinking their blood will not. Like let's say you're a vampire. You drink up someone's blood, someone who has HIV, you won't get HIV. I think. Instead, if you have a wound and they have a wound, and their blood gets mixed up with your blood through the wound, then yeah, I think that is possible because that's called blood transfusion, I think. Someone has to be careful when they are actually injured, and they're sick and whatnot, right? Or they're just injured but someone else is sick and whatnot, then they should be very careful. It's important to close up wounds, open wounds which have an opening, let's say some blood coming out or some blood clot or whatever. Keep it closed with a cotton, with a bandage and whatnot. It's important to not get infected by dust, say dirt and whatnot, sand, soil or whatever, and different particles in the air and whatnot, and different surfaces that you go through, different environments that you go through, and also you're not infected by other people and whatnot, right? So yeah, I mean typhoid. I think I can think of many ways that I could have contracted typhoid. I recently used a lot of public washrooms in my stadium. So I go to a stadium called Kantirva. Sometimes I use the washroom there. I think in the last 3-4 months I would have used that washroom say 2-3 times, and then I've used public pay and use washrooms say 4-5 times now in the last say 5 months, 6 months. 4-5 times, right? And then other public washrooms, say I go to a expo, running event expo, I used a public washroom once recently, and then it was a running event expo. It was a weird washroom anyways. And the thing is, I usually carry liquid soap with me, hand wash. Interestingly, I don't use it all the time. I mean, I usually have it all the time. If I carry my bag, it has it in it. But the expo event, I used it actually. But the thing is this, right? If there's a tap, let's say, I open the tap and then wash my hands, okay, I have to close the tap. I still use my hand to close the tap. And if the tap has some infection, say some bacteria, my hands still have it, right? So I think it's important to use hand sanitizers and all that afterwards, and especially before eating, and even after using washrooms, and even after using liquid soap and all that. I think it's important to use hand sanitizers, and just which has more than 60% alcohol, to actually do something called hand rub, which is basically put the hand sanitizer which has alcohol in it, I think propanol or whatever, and put it on your hand and rub your hands and whatnot. And I think it has to be done for some 20 seconds. I usually wash my hands for like some 5 to 10 seconds, max 15 seconds, I think, I don't know. So it's important to do it for 20 seconds, whatever you do. So usually people say sing happy birthday or something and then finish it off, wash your hand and all. So that's that. So I think I was using public washrooms. I travel sometimes to places, say Chennai and all that. I travel in trains. I usually travel in trains because I can use the washroom to go to the washroom to pee a lot, because again I use the public pay and use washrooms and whatnot, or say washrooms in the expo and whatnot, not intentionally, because I want to use the washroom because I need to pee. I need to pee a lot because I end up drinking a lot of water, and I drink water like this, right? Like I gulp half a liter or 1 liter, usually 1 liter of water all at once. Every 1 hour or so, I drink a gulp of 1 liter of water. I think the problem with gulping 1 liter of water all at once is that you basically end up peeing a lot. So instead of sipping water throughout the hour, throughout the day, if I gulp water all at once, apparently I'll pee more water. So I think the water will not stay in my body, which is also a problem because I'm drinking water to be hydrated. if the water just goes off as pee, most of the water goes off as pee after an hour or two, after an hour or so, say an hour and a half or two, it'll come out, right? Most of it will come out, I think. So then it's not a good idea, I think. I've been trying to not gulp up water. I've been thinking about this at times. At times I tried to actually ensure that I just drink say 250 ml or 500 ml at once. Say 250 ml every 15 minutes, so that which is 1 liter in 1 hour and whatnot, and drink quite some water during the day and at the start of the day, and then I can't drink much later because I'll be eating food and whatnot, so it'll be harder to drink water, more water later. And yeah, I mean, since I was drinking a lot of water, I ended up using public washrooms a lot, including washrooms in, say, trains. And I use the train mainly because I can use the washroom. I always use the liquid soap in the trains and wash my hands and all that. But yeah, even then, it's easy to say after washing hands, I have to use the doorknob. I still touch the doorknob and all, right? So I can still get infected. I think the most important thing is before eating, I should wash my hands, and after using the washroom, always use hand sanitizers. I think. Because, for example, say I've actually used my phone at times in my washroom in my work, right, in my workplace. Very rarely, because I get a call and I have to say, hey, I'm at the washroom or something, or I don't know, something comes up. Say in these 5-6 months at work, how many times would I have used my phone at the washroom? Probably 2-3 times. It's not a good idea to use phones in washrooms. It's very easy to drop your phone in the toilet bowl, and also it will be very embarrassing, and you wouldn't want to use your phone ever. You'd probably get rid of the phone, unless it's an iPhone and you're like, I don't want to give away 1 lakh money just like that. Anyways, but I fortunately have never dropped my phone on the floor in a washroom or in a toilet bowl and all. But I've seen funny movie scenes where people drop it off on the toilet bowl, so I almost always try to ensure that I never use the phone in the washroom. But yeah, it's very easy to touch your clothes, say touch your touch my spectacles in the washroom, and if your hand is infected or whatever, then that infection goes to the spectacles. Let's say you're adjusting it or something. Sometimes I remove my spectacles and, like, I'm like just trying to basically have a de-stressing moment in the washroom without my specs and whatnot. But then you touch the spectacles, right? And if you touch your pants and whatnot, it's all gonna get infected. So it's very tricky to use a washroom and keep yourself clean and all that. It's important for washrooms to be clean and for people using the washroom to be clean and not infected. For example, I got typhoid recently, right? I decided to not go to places at some point. I was like, it's easy for me to infect someone. Let's say my phone has some bacteria on it because I touched it. Say, I don't know, I touched it and like I did wash my hands and all that, but still, say I didn't wash my hand for some 20 seconds, instead I washed it for 10 seconds, and because of that it still has it, right? And I touched my phone and my phone has it, and no matter how much clean my hand is, if I touch my phone, it has the infection, and then if I touch someone, they get the infection, right? So it's a very sad thing to get typhoid or similar infections that can just go through touch, that is communicable through touch, or that is communicable through surfaces. Let's say I touch some table and then someone else touches that table. If they get infected, that's very sad. And then communicable diseases that get communicated through airborne diseases, right? And then I think typhoid is called vector-borne. I don't know why it's called vector-borne. Something for me to check out, research about. So yeah, I mean, it's a very sad thing for diseases to get spread like that. And yeah, I mean, I've actually washed my carrots and all in my at workplace where there's a sink to actually wash, say, coffee cups. and whatnot. People wash their coffee cups using liquid soap and whatnot, and then they fill up their coffee and all. Imagine like if that sink is actually giving recycled water, and if it's not properly recycled, right, and it contains contamination, say then contaminated because of some poop or I don't know, urine or whatever, and it's recycled and then but it's not properly recycled, then it's a problem for people who are using it to wash their coffee cups, or who are using it to wash their apples or carrots like me, or their pears or whatever fruit that they have, and then cut it and eat it, right? And then I generally eat my carrots raw, wash it up, and then eat it. I don't peel it off. Same is true for my apples. Sometimes people do talk about how apples have a wax surface and all on their skin, but then I didn't care recently. I just started eating them, and I was like, I don't think that is the case. I was just like eating green apples and red apples just like that, and pears and all just like that without peeling the skin. I think I was just too lazy, and I was also like, just eat it, no problem, whatever. I was too careless, I could say that, or too casual. And carrots, apples, and whatnot, when they are transported, it's possible that the people who transported it, touched it, could have infected it and whatnot, because they were sick, or they were sick at some point and they're still a carrier of typhoid. They didn't wash their hands after using the washroom, which is just disgusting. And then they touched food, and then like say apples or whatever, and then I got that apple. I cleaned it up, but it was not clean enough, and I ate it, and I contaminated myself. And then, of course, eating outside food. For example, I eat tender coconut. If the person cutting the tender coconut, if their hand is not clean, and if their knife is not clean, the knife is used to actually cut the tender coconut. Or the same is true for ice apples. The knife is used to cut the ice apple, and then even though they don't touch the ice apple, the knife touches the ice apple, and if they touch the knife and if their hand is infected, their knife is infected, and then the ice apple is also infected, right? So the same is true for cut fruits. People who are cutting fruits and selling fruits, cut fruit vendors, and also there is insects and mosquitoes. One of my friends was telling me, don't touch cockroach. I actually hit cockroaches with my hand sometimes, but I wash my hands. But am I washing it for enough time, enough seconds, and all is a question. Especially during monsoon season, cockroaches can actually go to different water sources and whatnot. Stay in bad water places, stay in bad environments, touch feces, touch urine and whatnot, go to washrooms, go to toilets and whatnot, and go around to go to a lot of places and carry a lot of bacteria and a lot of viruses and all along with them. So if I hit a cockroach, I'm actually touching a lot of bacteria, right? So that's also something to be wary of. So I was probably being either too courageous or too stupid, or both of it. Because too stupid because I'm touching it, right? Courageous in the sense that I was just showing off that I was just able to hit it, because previously I was not able to hit it. So I was just very courageous and showing off that previously I was scared of it, and now I'm not scared of it. But then the thing is, I should be scared not of it, but of the different microbes, bad pathogens that it could be carrying, and I should be afraid of that too. And I should be careful about washing away that from my hand or whatever I use to actually kill it. So that is that. And what else? And cutting my nails, right? My nails could have bacteria in it. Like, let's say I hit a cockroach and somehow some bacteria got into my nails. If I don't cut my nails and it just remains and I use my hands to eat, then it's going to be a problem, right? So a lot of ways I can actually contract, bad bacteria, pathogens they are called, and that can cause say typhoid and other diseases, right? And what else? So yeah, it's just disgusting. And eating outside food in general, people who prepare your food and all, right? I was recently going to talk about food and how it's actually a very preferential thing. One of the things that I think about is how food has to be prepared by someone who's at your level, right? When I say your level, I think I'm becoming a classist now in this case when I'm talking about this. I think a classist is someone who looks at class and discriminates based on class. So this class is about economic class and also about mindset and whatnot. I guess I don't know. So wherein they have some level of class. Like I want some. Like say I want to eat food and someone has to cook food for me. The person who cooks food for me, I want them to be at some level of class. I want them to have some level of money, to be at some level of economic class. They should have good amount of money, so they should belong to a good economical class. uh, let's say the same amount of money as me or more, a lot more, so that they wouldn't worry about using high cost ingredients and whatnot, and they wouldn't worry about let's say some cockroach entered the kitchen and spoiled a lot of ingredients. Then they wouldn't bat an eye, and instead they would just or they wouldn't overlook it, and they would just scrape off and get rid of all the infected ingredients, right? Instead of being like, we can't waste all this money, so let's just use it, it's fine, right? Someone who has less money will think like that, right? Or but even if they have more money, someone can think like that. So I want someone who cooks food for me to actually have a lot of money, to actually earn a lot of money, to actually not worry about money and actually worry about food hygiene, food preparation hygiene, personal hygiene. For example, cut their nails and not have nails that is big and dirty and whatnot. If they're using hands to actually make food, and cover their hair so that they don't put hair on the food. It's not that it's disgusting, it's more about hygiene, because hair can contain oil, that is one thing, but it can also contain a lot of bad things also from the air. Hair can actually get a lot of bad stuff from the air that it is in, right? Let's say sand, soil. Let's say you traveled to the place where you're cooking, and it got a lot of sand from the pollution and whatnot, and now the hair falls off on the food. Now there's a lot of things that get mixed up in the food, right? That's the problem with hair on food. Though a lot of people think, dude, it's just hair. I agree. Even I used to think like that. I used to think like that. But the reality is that hair can contain not just oil, but it can also contain a lot of bad stuff, right? And people also touch their hair a lot, right? Then when they touch their hair, their hand can contain bad bacteria, pathogens, which can actually get transferred to the hair, and then the hair falls on the food. It's still a problem, right? And if the person who is serving you food, let's say they have typhoid, then they should actually not make food for you. If they are injured, if they are sick, if they have a disease that can actually be communicated, like that's communicable, then that can be spread, then they shouldn't serve food. One of the things that I read about when I saw about typhoid was, you shouldn't serve food, right? So I even told my niece, nephew to not visit me and whatnot. My sister to tell, like, I told her, hey, don't visit me, and my mom is at risk now currently. Though I got a test saying that I'm negative on typhoid, I still have to do probably a stool test and urine test, which can contain my typhoid bacteria. My poop and my urine can contain it. Then I should be really careful about using the washroom. And my mom uses the washroom. My mom uses the washroom different from the washroom that I use, and we should be really careful about what I touch, and I should be really careful about washing my hands often, and keeping my hands really clean, and ensuring that the surfaces that I touch are clean. Say my phone and whatnot, so that when I touch my phone again, my hands are not infected by the phone, right? And I also visit the hospital a lot. I go to the emergency room to get the injections for this typhoid thing. Today is the 5th day for it, and if I'm visiting the hospital, there can be bacteria and viruses that I can actually get from there and whatnot, right? So I have to be careful about hygiene. Some people say, well, be immune. That is also true. I agree. Like one of my friends told me that, dude, you don't have to worry too much. And I was telling about how my hostel, the area is pretty much business oriented. A lot of hostels, a lot of businesses, a lot of food businesses, and they don't clean up the roads that they make a mess out of, right? They actually uh, put a lot of food waste, say sauce bottles and wrappers and whatnot, food wrappers and packaging wrappers and whatnot, packaging material and whatnot. It's very messed up, and that can cause a lot of mosquitoes and whatnot to actually come up, and basically it will attract a lot of mosquitoes, insects, pests, say cockroaches and whatnot. And when water stagnates, it will get worse. It will attract more mosquitoes. It will breed mosquitoes and whatnot, and it will start spreading viruses and bacteria. Those mosquitoes will start spreading viruses and bacteria. For example, like I mentioned about how cockroach can actually go from one place to another and then spread a bacteria or a virus or whatever, right? Any pathogenic thing like microorganism and all that. So then let's say cockroach sits on some infected stagnated water or shit or urine or whatever, and then moves to some other place and then infects that. The same is true for like insects, small insects, any kind of insects, and then small mosquitoes, right? So mosquitoes can fly, right? So now we can go to any place and infect anything. Let's say you have a cut fruit vendor. If they are not careful, the mosquito can go inside their box where they store the cut fruit. It can sit on the fruit, and if it already sat on some shit or whatever, say dog shit or human shit or whatever, or dog urine or human urine or whatever, or some garbage, sewage, or say stagnated water or whatever, infected place, and then it flies around and then finally sits on some food material, say cut fruit or whatever, then it's a problem. One of the first things that my doctor said was don't eat street food, right? The thing is, he basically meant that he said that mosquitoes will sit on them and whatnot, so it's a problem. The problem is mosquitoes can actually transfer and spread and carry bacteria and virus, right? So that's the problem. And they also carry bacteria, virus and all, and they'll bite you with it, and they'll infect you. And I think if they bite some infected person, say someone infected with dengue, and then they bite you, you will get dengue, right? So yeah, I mean, a lot of this can happen. And if an environment that you live in, let's say my hostel, where it's a business area, a lot of messes around the roads that I go to, and they're not keeping it clean. And Bangalore in general apparently is not a great place, in the sense that when it gets rainy, which is almost always the case, almost throughout the year it can rain almost any time. A lot of months in the year it rains in Bangalore, and the physical infrastructure of Bangalore is really, really bad. It's shitty, it's dumb. I would say the infrastructure is very, very bad, is what I've heard, and I would want to just exaggerate it and put it out here that Bangalore is the worst infrastructure. Just like that, I'll blindly say it, though I don't know for sure, because I've heard that the physical infrastructure is very bad, right? Especially when water stagnates, especially when it's raining, it's really, really bad. So what does this cause, right? When water stagnates, this causes, well, you know what it causes: malaria and whatnot. Dengue and whatnot, like basically mosquitoes to breed and whatnot. I think the Karnataka state government does have to do a lot of work there in the physical infrastructure. I've heard that, this is what I've heard from people, sane people, very smart people, that the physical infrastructure is really, really bad, but Bangalore in terms of tech has improved a lot, in terms of software, right? So this is something for me to research on, but for now I'll have a firm belief that though there is no solid evidence, based on what I've seen and what I've heard, I will just firmly believe, until and unless I'm proven wrong, that I'll think the worst, which is Bangalore has the worst physical infrastructure. And I know that they're improving in terms of like trying to build metro and all that, but in terms of like good roads, cleanliness and whatnot, I don't know how far they've come. I've heard that Chennai and other places are better, and like say places like Bangalore and all, Hyderabad and all is better. Bangalore, yeah, and I just know that the traffic in Bangalore is really really bad. I can see that they're trying to do something better in the metro stuff and whatnot, like bring in more metro stations and whatnot, and open up more metro stations and open up more metro paths, more paths for the metro to go. Um, but yeah, in terms of cleanliness, hygiene, physical infrastructure, and water drainage system, sewage system, and whatnot, I don't know how good it is. I'm sure it's not the best, because when I was googling what is the best, something else came up. Like I think Mysore came up for drainage system. For sewage system, I think Andhra Pradesh came up. Apparently, there's a difference between drainage and sewage system. I think drainage is for how the water drains out in case water stagnates, and then sewage system is all about how bad, say, sewage, which is say poop, shit, urine and whatnot, how does it go from houses and the residential area to some place, and then how does it get processed and what do you say, purified, or like recycled, like properly processed, so that it doesn't affect people, and it's disinfected. How is it disinfected and whatnot, and how is it processed and cleaned up and whatnot. So I think that is what sewage system is all about. And drainage is just about how water gets drained up, I think, in case water gets stagnated in different places, let's say roads and whatnot. And also in, say, I don't know, dams, and like how if water is overflowing in dams and whatnot, and canals, and I don't know all these terms yet. I'm still learning, but yeah. So yeah, I mean, the place I am in, this hostel, it's a bit messy. So I was wondering I should move to a different place, and then one of my friends was like, "Dude, you don't live in a place where drinking water, feces, and whatnot is all mixed up." It is true, but people recycle water. I don't know how often and how better they recycle water, and where and all the recycled water is used up. Let's say I bathe in some water, how is that water coming up? I drink some water, how is that water coming up? I know it's actually reverse osmosis and whatnot, but before doing reverse osmosis, what happens to that water? Where is it coming from? What is the water source? For my wash basin, which I use to brush my teeth, where is the water coming from? For the sink, the water that I use to wash my plates, my spoon, and whatnot, where is that water coming from? I want to know all that, right? So I want it to be clean, because or else it's going to be a problem for me, right? Because I'll get contaminated by that water, right? And I also want people in my hostel to actually be clean. For example, if someone gets infected with dengue, they should not actually be present in the hostel. They should go to some place, say their hometown and whatnot, because if there are mosquitoes and if there is someone with dengue, then other people will get dengue, right? For example, one of the caretakers in the hostel had dengue. I was like, oh my god, and there are mosquitoes all around because it's monsoon season, right? So I am scared to actually sit near him. Though I like him, I talk to him and whatnot. I'm like, what if some mosquito comes and bites him and then bites me? I'll also get dengue, right? And one of my friends was telling me, you just be immune, dude. That's all. Don't worry about all this. It is true, but how much can your immune system actually fight with things, right? How bad, like, let's say, this is just layman terms. I don't know how scientific and all that. I'm still going to research on this. But let's assume that this is the size of the problem, right? Let's say some bacteria, virus, and whatnot. Let's say your immune system can fight it. Let's say we make it this bigger, and your immune system can fight it. Let's say we make it this bigger. Like, how bigger can I make? How big of a problem can I take and then attack your immune system with? And then how much can it take? Like, where is the tipping point for your immune system that at some point your immune system is like, dude, that's all, I can't fight more than this, I give up, or I'm not strong enough to fight this, so now you're going to be infected. And also, even if your immune system can fight it off, while it is fighting, you will still have fever and whatnot, you will have the symptoms of the problem and whatnot. Maybe you will get out of it, but your immune system will still struggle and fight it off, and then I think your white blood cells and whatnot, I guess, I don't know too much, but your immune system will fight it off and you will get out of it. But uh, do you really have to do it is the question. And the next thing is, I was telling my friend, maybe we should all start getting vaccinations. I should start getting vaccinations. She was telling that there's no vaccination for dengue, but apparently there is now. Apparently it was not there before, and she was saying it's a viral infection. You don't have a vaccine for it. You have a vaccine for it. I think viral infections can also have vaccines. So I mean, COVID was also virus. COVID is a virus. Was a virus. Everything. So it was. The problem was a viral infection, COVID. COVID-19 and whatnot, and there was a vaccine for it. Right? There is a vaccine for it. So dengue has a vaccine now, and it is there in India also. And I think typhoid I haven't checked out, but malaria has a vaccine. I've checked it out. Recently, I've noticed there was a post by WHO, World Health Organization, on WhatsApp channel, saying that a woman in Kenya was actually delivering malaria vaccinations to all the children there, children under 5, under 2, because a lot of children were dying out of malaria and whatnot, right? So it's important to get vaccinations. So this friend was saying, who's a dentist. She's not some layman, just some person who doesn't know science. She was saying getting a vaccine might be a stretch, like basically getting yourself the disease, because vaccine you will get the disease a bit, you will struggle a bit, but not too much as the real disease. It depends though. I think it depends on the kind of vaccine. I think one kind of vaccine is dead virus, dead bacteria. I don't know exactly. The other virus is like activated virus, activated bacteria. Other vaccine, I don't know. There's some different kinds of vaccines. So depending on the kind of vaccine you get and whatnot, you will still probably go through some phase of like being sick, but it won't be long. But your immune system will understand and learn to attack this virus or bacteria. I don't know vaccines can be used only for viruses or only for bacteria, or like I think it can be used for viruses because COVID was a virus and it was possible. Bacteria, I don't know. I'm yet to learn about it, but yeah, I mean, if it can fight things off, if it can learn, great. That's the idea about vaccines, I believe, wherein your immune system learns to fight off bad stuff, right? But you go through the struggle while it's fighting it off and all that, and learning to fight it off. You will have fever and stuff like that, right? Depending on how good or bad your immune system is, and like how weak or strong you are in general. I think that's all about the immune system, I believe. Yeah, I mean, so I was talking about food, right? Like someone who cooks for me, I think their class should be really high, wherein they consider hygiene to be very important, and their cooking methods are great and very hygienic and whatnot, and they are not sick, they are not injured, they are not diseased and whatnot. They can serve food, they are allowed to serve food, they are certified to serve food, and they should be tested often and whatnot, right? Ideally, that's the level of hygiene I expect from my chef, my cook, right, who's cooking for me, because I think what you eat is a very important thing. Though immunity is also important, like my friends say, like you just eat good food and be immune. Like that's what my dentist friend was saying. You just need to ensure that your food is good. Don't worry about your hostel and all that. When I said I'm planning to move, right? And the other friend said, be immune, man. Don't worry about stuff. And it is true, be immune, eat good food and whatnot. But the thing is, I don't want to like intentionally make my body struggle, especially to the level that it's like really bad. Like, how stupid is it to put myself, let's say, in a very very bad situation? Let's say I get into the sewage tank of some building which has all the sewage in it, which is basically all the urine, shit and whatnot. Let's say I get into that. That's just me being stupid, right? If I intentionally get into it, realizing that it has a lot of bacteria, virus and whatnot, and if I get into it, I'm going to catch a lot of bad problems, right? So similar to that, I don't want to intentionally put myself in situations where environments and situations where I end up contracting something bad. So if I can, I'll try to avoid it. People tell me all the time about like eat all the food that you can get your hands on. Whatever you like eat, don't omit. Like my mom keeps saying, you keep omitting stuff. You keep omitting sugar, and I'm like, in my head, I'm like, I don't need sugar, right? I'm already eating a lot of sugar. For example, I am drinking a lot of ORS water, oral rehydration salt, which is not just salt, which I learned pretty late because once I started drinking it, it was really nice. I love salt actually. That's a problem. I like salt. Let's say I don't love salt. I like salt, and it also has sugar in it, right? It's multiple teaspoons of sugar along with multiple teaspoons of salt, different kinds of salt, some potassium, sodium, chloride, and whatnot, citrate and whatnot. And I'm drinking a lot of sugar, but I don't need it. I need it now because my health is bad. I need glucose. I need sugar. Though I can get glucose, of course, from normal food, I'm taking this ORS also to rehydrate myself and all that. Because I had a lot of diarrhea, dysentery, loose motion, whatever you call it. And my mom was saying, you are omitting a lot of stuff. Like, yeah, I mean, I'm intentionally omitting sugar because I don't need sugar. I'm already eating, I'm already eating fruits, natural sugars, quite some fruits. I ate a lot of bananas recently, and I generally eat stuff like dry fruits, dates, not dates, sorry, dates is like pretty much too much sugar, raisins, black raisins, but I'm going to stop once my stock gets over. I also eat dry fruits like dry fig, which is dried fig fruit, right? It is also concentrated in sugar, right? And I don't need it. I don't need that much sugar. The body doesn't need sugar. If you need glucose, you can get it from normal food, right? You don't need sucrose and whatnot, and fructose and whatnot, or saccharine, is it? I don't know, like all of these. You don't need it externally, extra like artificial sugar, refined sugar, added sugar, and whatnot. Fruit, fructose, sugar, fruit, natural sugar, and whatnot. You don't need it. Your body doesn't need it. Your body needs energy, and you can get that energy from glucose, which you can get from normal food, right? Which is not sweet by itself. It is not sugar itself. It is just glucose. It's carbohydrates which can get converted into glucose and all, I think, right? So carbohydrates and different stuff. I don't know how it works, but people eat all the macronutrients and whatnot, carbohydrates, fat, proteins, and all, right? So yeah, I mean, my mom says, oh, don't omit stuff. My friends say, eat everything so that your body is immune to it and your stomach is strong and whatnot. I mean, but how much? How much should I actually attack my stomach, attack my immune system, attack my body with bad stuff that I know is bad? Why? Like, how much should I do it? What is the tipping point that it gets worse, right? So, and is it really necessary also to do this, right? Though in the past I've thought about like how there are kids who play in the soil, sand, and they are immune to a lot of things versus a lot of kids these days who are not allowed to play in the sand and soil because the parents are worried that they'll actually catch some virus and bacteria. Both has some pros and cons. Of course, people playing on the sand can get immune. People who don't play on the sand can get weak because they're not playing on the sand. But then depending on the kind of sand they're playing on, the soil they're playing on, it depends, right? If the sand really has a lot of bacteria in it, maybe playing on it is not a good idea, right? Maybe playing off of it is better, right? And eating the sand and whatnot is probably not a good idea if the sand has a lot of bacteria in it, because let's say some dog pooped on it on the sand and like the sand and the poop decayed on the sand, and let's say some dog peed on the sand and whatnot, let's say it's park sand and whatnot or beach sand and whatnot, right? So playing on the sand is fine, but then to what extent and what do you do after playing on the sand? How do you keep your hands clean? How do you ensure that your kid is not eating the sand? And how good or bad is that, right? So the level of attack on your system because of all this bad stuff is the question, right? On your system, on your immune system, on your body, and all that. So how bad is the thing, right? The food, or say the environment that you're in and all that. So yeah, I mean, I agree that yeah, to some extent, immune system is important. To a good extent, immune system is important, and I agree that it's important to actually challenge your immune system. Let's say through vaccines and all, and so that the immune system also learns and all. But then, apart from vaccines, challenging your immune system yourself through some stuff, how good or bad is it? I don't know. Challenging your stomach, your different organs through stuff. Let's say, would you say drink alcohol every day so that your stomach or your liver is very strong? I don't know. I don't think so. Or drink or smoke 2 cigarettes every day and whatnot. You don't really need cigarettes. You don't need sugar. You don't need cigarettes. You don't need alcohol and all that to live a life, good life, great life, happy life, amazing life. Your body does not require any of these, right? Your body does not require all these drugs also, all these narcotic drugs and all that, right? So but then would you say do it so that your body is immune to it, or your body can take it and is not very weak? Stupid, right? But then yeah, I don't want to use that analogy because analogy is just to relate, not for logic. So I don't want to use it to compare it with food and sand, playing in sand and all that. But surely would you say go and eat pizzas and burgers once in a while, so that your body is actually strong enough to eat it? Because if you don't eat it once in a while and then some days you do eat it and then your stomach gets really weak to handle it, well, two things, right? First of all, is it possible that my stomach is just not okay to handle it for some reason? Let's say people say lactose intolerance and all that. I don't know how true it is, or something or the other, right? For example, my body doesn't take bread really well, especially large amounts of bread, right? Every person has allergies and whatnot, though it's a fancy term, and people are like, especially in India, people are like, oh, you have an allergy. But then in the US and whatnot, people are always very empathetic, and they're like, oh, you have a nut allergy, or you have a gluten allergy or whatnot, right? Or lactose intolerance and whatnot. So they ask for food preferences and whatnot. They care about your preferences. I think the only person who cares about your preferences is you, because anyone else, I doubt it. Only if they care about you, they'll probably consider your food preferences. Even if they care about you, it's possible that they'll overlook your preferences. So in my case also, for my food preferences, I have to be really careful and I have to care about it, right? So I mean, should I really eat pizzas once in a while just so that I can eat someday once, and my body doesn't react badly to it? Or should I just avoid pizza all the way so that maybe once in a while, maybe I might eat it, but I'm fine if problems come up, I'll be like, well, I didn't eat it all this time, and I didn't eat it because of a reason, because I considered it to be bad and I considered it to be unnecessary, and I ate it today and I faced the consequences. That's all. I'll be like that, right? Same is true for burgers or French fries or deep fried food and all, right? I agree that it's really tasty. I agree sugar is tasty. I agree ice creams, frozen desserts are all great and whatnot. But yeah, I don't want them. I don't want to just play with my system, right? Though one might say your system becomes more immune and whatnot. I want to research on that, but I don't want to play with it like that. Play with my system, my immune system and whatnot, my stomach and my intestines and whatnot. So yeah, that's that. And I don't want to simply ingest crazy bad chemicals. I ingest probably enough bad chemicals already, because people grow fruits, vegetables with a lot of pesticides and whatnot, fertilizers and whatnot. But then I don't want to ingest more intentionally, right? So yeah, I mean, and in general, I think no one should get illnesses. Say typhoid. This was very bad. Like, I didn't like it. Right, I was in a bad place all these 5 days. I was just sleeping all the time, tired and whatnot. I'm not sure if it's the Chennai weather. I'm in Chennai now, which has a bit of a different weather than Bangalore. And also dealing with my parents with all these problems. My parents are always worried about my health, and I think no one should have health problems. Everyone should be hale and healthy and happy and nice. and having a great day and great life and great amazing life, right? Be it physical illness, mental illness, and whatnot. I think no one should have it. There should be more vaccinations. I believe prevention is better than cure. The cost of prevention is probably very less compared to the cost of cure. If the cost of cure is lesser, then probably people will focus more on the cure, but then it really depends. Because when I say cost, it's not just about money. There is time, effort, energy, there is physical and mental agony, physical and mental pain, right? And and then there is also the damage that is done to your body, your health, when you have a illness, right? So the cost of all that has to be considered. So I believe most of the time, almost 99.999% of the time, I believe, based on some assumptions, I'm like, surely prevention must be less costlier than cure. So I think there should be vaccinations, there should be clean washrooms. People should be aware of how they can actually infect other people, and there should be good immune systems, because it's not always possible to force everyone to actually be clean and hygienic. But you can actually make people aware of how other people can be unhygienic and whatnot. Other things and food items and water can be unhygienic, and how they can ensure that they can, you know, act with hygiene in their mind, and they can be like, they can be like, okay, I'll follow hygienic stuff, I'll follow hygienic guidelines, and be like, okay, this is what is hygienic and this is not hygienic, so I'll follow what is hygienic, right? They can act on their awareness, and what else? They can act and be hygienic, and they can improve their immune system, so that even if others are unhygienic, their immune system can help them as much as possible. And vaccinations should also help. And then, of course, cure also should be easy and better and nice. uh, you know Healthcare has to be great, patient-centric healthcare, where the patient's needs, wants are taken care of. Say the patient is in pain, the patient is in mental agony or physical agony, it should be taken care of, and the focus should be on the patient, the person with the illness or ailment, right? And according to me, no one should get typhoid, malaria, dengue, cholera, and all that, right? So hygiene, vaccinations, immune system, like all of this has to be good, and healthcare has to be good for the cure also. And imagine, right? Let's say someone gets a disease. For cure, you have to actually go to the hospital, meet a doctor, diagnose, get a blood test, diagnose, get some scans, maybe depending on the kind of illness and ailment and whatnot. Talk to them if it's a mental illness and whatnot, and then finally understand what is the illness and go to the doctor for medicines and tests and whatnot, and then pay a lot of money for all of that. Versus, let's say, immune system, and I don't know, like physical immune system is one thing, and then there is the mental immune system. Like, how can you be mentally strong so that you can actually prevent yourself from mental ailments and mental health illnesses and whatnot, right? How can you use food, diet, basically, and exercise, and say mental health exercise, like say meditation and mindfulness exercises and whatnot, and then physical exercise and whatnot, to ensure that you're strong enough to actually be able to handle the things that life throws at you, right? But even then, there are going to be some problems, traumas, and whatnot that you probably can't handle with just this. Even then, the cure should be cheap. The cost of cure should be cheap. But as much as possible, I think prevention should be possible. And I believe that prevention, the cost of prevention is always cheaper. And so vaccinations, immune system, good healthcare, hygiene, these should help. And vaccinations should be cheap, and cure should also be cheap. I'm a very idealistic person. And imagine, right, this is just typhoid, malaria, dengue, and all that. there are really, really bad illnesses and ailments and diseases out there. There is cancer, there are blood cancers and whatnot, there is leukemia and all that. There are disorders, there are mental health disorders, bipolar disorder, and then there is obsessive compulsive disorder. I have obsessive compulsive disorder, okay? I take medicines for that. And I go to therapy to a psychiatrist for that, right? And there are people who actually go through a lot of mental health issues, say because of some trauma. Let's say they lost someone in their life, they lost their child, 1-year-old child, or they lost their parent. They're a small child, they lost their parent, or they lost their parent when they were a small child. Now they're grown up and they have mental health issues because of their lost parent, or they just lost their parent recently. They're grown up and they lost their parent recently. They lost their partner, they got sexually abused, they got raped and whatnot. All of these can actually cause a lot of problems for people, right? A lot of bad stuff is out there in the world, and I think mental health illnesses, loneliness, cancer are all like big stuff. And then there is diabetes and whatnot, the popular stuff like diabetes, heart diseases and whatnot. Did you know that there's a difference between stroke and cardiac arrest and stroke, right? Cardiac arrest can happen to anyone apparently, not just for someone who is old and all, or not just with, I mean, even a healthy person can have a cardiac arrest. Apparently, a cardiac arrest is where your heart just stops pumping suddenly for some reason, right? But I think stroke or the heart attack is all about your arteries being blocked by some, say, particles, say food, like say some cholesterol or whatever. I don't know what it gets blocked by, but there are some particles in your arteries and it gets blocked, so it's not able to pump blood, I think, out to the organs through the arteries, because arteries carry the blood to the organs and then veins carry the blood from the organs to the heart, right? So I think that's where the heart attack comes in, wherein suddenly it's not able to move the blood through the artery, right? The artery is blocked, and then I think they clean up the artery and things like that. They blast the particles, I think it's called angioblast or something, or they do some open heart surgery, they cut the artery, they do some bypass and whatnot to ensure that the blood flow can still happen. Versus cardiac arrest is simply there is an electrical pulse around some vein or something that does some electrical pulse, which ensures that your heart is pumping. If that electrical pulse thing stops, your heart stops pumping. I believe that's what is cardiac arrest. That's what I've learned, at least. And it can happen to anyone, right? Even a healthy person, suddenly cardiac arrest for no reason the heart stops pumping, right? It just stops. The electrical pulse just stops. I think that's where pacemakers come into play, I think. So there's a difference right over there. So the pacemaker is what then creates the electrical pulse so that your heart pumps, right? So there's a lot of heart stuff and health stuff out there. Heart stuff, cancer stuff, mental health stuff, and also diseases like, all these cholera, hygiene-based diseases and whatnot, and then really fatal diseases. Apparently, typhoid is also actually severe depending on how bad it is for you. For me, it was moderate, right? It can be severe apparently, it can be fatal, it can be bad also apparently, right? For me, it was moderate, and I was diagnosed soon, so great, right? So I think it's important for people to have accessible healthcare, because, for example, the person in my hostel who was a caretaker, who actually doesn't sleep all night and watches the reception and lets people in and out of the hostel at night times, because you need someone to guard the hostel, right? You can't keep it open, but you still need to allow people in and out, the people who belong to the hostel. So you need someone to, there is no automated system like facial recognition system and whatnot, and even if there is one, it's possible to bypass it and let someone in and all that, right? So you don't want to let bad people in and strangers in, and it's actually not allowed in our hostel to let people in, outsiders in, right? Guests in, only till reception and no further. So this person sits all night over there. He doesn't have enough money. he has to even think about spending money to actually take a blood test to check his platelet count as part of his blood count, the complete blood count test, to check if his platelet count is pretty low, to check if he still has dengue and if he's still recurring, right? So he needs money for that, right? And interestingly, if you see the cheap healthcare companies, the cheap ones that provide accessible services, say blood tests and whatnot, they will actually give you the report, but they will give it very late because they take a lot of time. I think that's where they cost less money because they will just take a lot of time. If you need it really fast, you need to pay more money sometimes, right? So this person needed his results pretty fast because he was already affected by dengue, right? So he can't wait one day and be like, okay, so the platelet count will change so fast, so you need to actually get the results really, really fast to understand what is the current exact count, right? So he was telling me how he'll take his blood count again later. His blood count, I think platelet count was around less than 1 lakh, some 90,000. It has to be more than 1.5 lakhs to 4. It has to be in the range of 1.5 lakhs to 4.5 lakhs. He was having 90,000, right? And I was like, dude, this is a bit problematic because if it goes pretty low, it's actually fatal. It's problematic, right? And he was like, I'll take my blood count again probably 1 or 2 days later because he has to consider the amount of money it costs, right? And I was like, you should probably get admitted so that they'll take your blood tests often. And then I realized that he doesn't have money, right? And then I was like, okay, probably try out the government hospitals, right? I don't know how good the government hospitals are in India. It depends on the place you are in and whatnot, and the kind of care that they're trying to provide and whatnot, right? So he was like, okay, I'll check it out. The problem is now he doesn't have accessible health care, and he's working there, and he has dengue. He's working over the night. There are mosquitoes, lurking around at night, and though he has mosquito repellents, all around him, it still doesn't protect him completely, and people in the hostel can get infected because of some mosquito biting him and then biting someone else and all that, right? So yeah, I mean, accessible healthcare is important, right? So that people can cure themselves when they're infected, can actually diagnose themselves with enough money or no money, right? So and the same is true for, like, I don't want anyone to get cancer ever, right? Or any kind of disease, but it is happening already today. Lot of people don't even have enough money, and even if they have enough money, they don't have enough power and money to actually accelerate the speed at which we need to innovate for medical advancements. Like recently I learned about some issue that one small girl had, and her parents were actually very, very wealthy and powerful, I think. But they still couldn't actually get a cure for for their daughter. So the parents had to move around from the US to India and India to US and whatnot. They tried to actually reach out to different medical researchers. Apparently, she had some issue with her gene or DNA or RNA, and one of the things they were trying was actually mutate that gene or RNA or DNA, and so that the problems end, right? Because some issue in the gene or RNA or DNA, I don't know what, was causing problems, and this was something new that they were trying, right? And they learned a lot, but unfortunately they lost her, and like they were doing some research, they were in the process of doing research and all. Like, the idea was to get some cure in 6 months or so, but in 4 months the child died, right? It's a very sad thing, and people are trying to do better research on cancer cells. There are so many different forms of cancer. Cancer can occur anywhere, right? Your tongue. I recently heard someone who said that their husband had a tongue cancer and they had to amputate the tongue, right? And someone who's infected by cancer, they can get cancer again, right? Their body might have some cancer cells that can get activated later and whatnot. So it's crazy. I think cancer and all is like pretty crazy because the people who get cancer, they have to go through a lot. It's a mental agony, physical agony, the chemotherapy, the medicines, the whole process, and any surgery that they need to do and whatnot. It's all crazy, right? And the same is true for even mental illnesses and whatnot, mental health illnesses, issues. people go through a lot. Then there are surgeries and stuff and medications and stuff even for people with mental health issues, right? So there are a lot of bad stuff, bad ailments, diseases, and illnesses out there. Uh, I think there are a lot of common ones, and then there are a lot of big ones like heart attacks and diabetes and cancer and whatnot, and then mental health illnesses, and then a lot of like uh, like big illnesses in small numbers or some big numbers, and then some small to big illnesses in very very big numbers, depending on the kind of environments you're in. For example, there might be a lot of villages and very badly infected places in the world with lot of typhoid, cholera, where the hygiene is really bad, right? And then there will be a lot of places in the world where there's a lot of cancer, right? So all these viruses, bacteria are not going to look at your age, your gender, your sexuality, your wealth, your power, your status, and whatnot. They're just going to be like, I'll come attack you and you're done for. I think anyone in the world should be able to get access to good healthcare, and ideally, I want to prevent ailments. Ideally, I want a world where, as much as possible, there are zero ailments, illnesses, diseases out there. And I'm going to work towards a world where, the world is empathetic to people who are ill and ill, sick, and all. And the world is also innovating in the healthcare, line of industry, healthcare industry, and healthcare field. To ensure that issues can be prevented through better immune system, vaccination and whatnot, and also through different schemes to ensure that hygiene is taken care of and whatnot, and bad food is avoided. For example, a lot of stuff around cancer is around carcinogenic products and carcinogens. So a lot of stuff is around carcinogenic stuff. Like if you eat something carcinogenic, I think that can cause cancer. So I mean, the government can also help here to put restrictions on stuff that is carcinogenic, right? And I'm talking about banning and all that, though it's a bad term. But at the cost of killing someone, I would rather ban something and annoy people and be like, no, this is banned because this is bad for health. Though this tastes really good, though this feels really good, though this is pleasurable and whatnot. And though this is nice and whatnot, or this is probably the innovation of the century and whatnot, I don't care if it's going to cause cancer or bad stuff to people. I think I would rather ban it. And I know I'm talking like some when I say I'm going to ban it, I'm talking like some dictator, I don't know. And also ensure that cure is also nice and accessible for people, right? I'm going to work towards a world that is like that. An ideal world, where prevention is better than cure, and is easier than cure, and prevention is done more, and cure is done less, and is required less, and whenever it's required, it's done, and it's accessible, right? An ideal world is what I'm looking towards, and I'm going to work towards. I'll urge and encourage everyone to actually work towards an ideal world where healthcare is actually prime and important, and health is prime and important for everyone. That's all I had for this video. Let's see the next one. Bye bye.